I hope you can hear me. Um, if you can't, could you please let the presenter know? I apologize for my tardiness and getting the system set up. Um, my name is Dr. Vernon Rayford. I'm an internal medicine pediatrics trained physician with an extra certification in obesity medicine. Primarily work in primary care, which means general patients, um, mostly adults. And while taking care of the regular routine problems, I try to also use some of the training that I've learned in obesity medicine. And so today I'm going to talk to you about bariatric surgery and primary care. And the way I like to split the talk up is to think about um, people at different phases in terms of bariatric surgery. And it can be split up in even more ways. There are the people who are considering bariatric surgery. And so these are people obviously who have not kind of been scheduled for surgery, people who are thinking about it as an option to improve their health. There are people who are considering it, but have done what many of you have done, have signed up for the seminar and have plans to have the evaluation and to kind of be really evaluated um, for surgery, and you anticipate having the surgery. There are people who are um, there are people who are right around the time of surgery, so that immediate period before surgery, that period immediately after surgery, and then there are people who are um, a ways down from surgery, so months out, even to years out from surgery. So starting back with the first group, that's people who are seeing their physician or nurse practitioner, people with conditions that may benefit from weight loss surgery. Um, those people are, ones where maybe they haven't fully made their mind up for the surgery. Um, and and so kind of just talking about some interactions. Vivian, can you give me a thumbs up or a chat? I'm getting some chat messages that I may not be heard. Can you just confirm that that my voice is coming out?
I can.
Okay, cool. So um, for that person having trouble with the chat, maybe signing off and signing back in, the audio may work. But um, but I just want to, so the kind of early conversations. So those are the times where, as a physician or a nurse practitioner, we're saying, hey, you have these conditions that may be associated with weight. Things like diabetes, pre-diabetes, which is the preclinical state for diabetes, and and what it that preclinical state. We know that if people are able to lose weight and regularly exercise, they can reduce their risk of having diabetes in the future. Um, High blood pressure, cholesterol, heart disease, arthritis. So joint disease may be a or under recognized condition associated with excess weight. Many people aren't aware that acid reflux is associated with weight and would benefit from weight loss, particularly weight loss surgeries. Um, Sleep apnea is something that fatty liver disease for women, polycystic ovarian syndrome. All of those are conditions that would significantly improve with weight loss and in particular weight loss surgery, um, related weight loss. And so having those things, having those things kind of, being aware. So a first part of primary care and weight loss surgery is really making sure that you are established with someone who can identify those problems and then be able to answer that question that, if you're kind of in that early phase when you're just considering it, this question of Dr. Rayford, do you think that my blood pressure will get better if I lose a significant amount of weight or if I have weight loss surgery? Same thing for fatty liver disease, PCOS, um, joint disease, sleep apnea. Many of those conditions, the answer is yes, that with significant weight loss, those conditions are expected to improve. And so, first, for that early group in primary care, having the diagnosis of those weight related complications. Maybe you are feeling fine, but you know that you carry excess weight and you have a family history of some of those things. Engaging with primary care to screen you for some of those things, like prediabetes. You don't know you have prediabetes unless you've been screened for it. And so you only can get screened if you're presenting yourself for screening. And so establishing with primary care so that you can be screened. And then once you know or have those questions answered, usually another question for primary care is, well, I've thought about weight loss. I've tried this many things in the past, and I'm considering weight loss surgery. And you've learned that the conditions that you have could be expected to improve. um, and so the next step is, well, how do I go about learning more? And in primary care, what we can do is help point you to things like the seminars, point you to the weight loss clinic, point you to the website so that you can kind of move into that next phase. The next phase, you've thought about it, you have decided that this is something that would be beneficial for you. You've come to the seminars, you've engaged with the people at the weight loss clinic, and you are making preparations. And so, where we are in primary care, it's really important to have those, time where you're getting together with your primary care physician or nurse practitioner, and you're saying, I'm about to have weight loss surgery. The date is set, and I have these conditions. How do you expect these conditions will change based on my anticipated weight loss surgery? And so, important, many people will, before weight loss surgery, be on lots of medications for those chronic diseases, diabetes medicines, cholesterol medicines, blood pressure medications, arthritis medications. And a good number of people are able to, after surgery, no longer be on those medications. But there are some people who are on medications that are actually continued. And so it's more individualized, and it's definitely important to coordinate with your primary care on the clinicians at the with surgery, Vivian and Holly now, and Dr. Carlson and Dr. Pinson, are really great about post-surgery medication adjustments. And that's only made better with coordination with your primary care physician, as well, and anticipation. And so you can kind of, there may be some technical things that, hey, you anticipate having surgery in, 2 weeks and you need refills. Well, if you don't want to, you may want to just refill a 2 week supply because you may not be on those medicines, but then having that conversation about, what medicine changes can you expect after surgery? And as you get closer and closer to the day, so there's going to be some dietary changes. So there'll be a pre-surgery diet that you'll need to follow. Again, the question with your primary care nurse practitioner or physician is, now that I'm doing the pre-surgery diet and anticipate kind of doing the post-surgery diet, does this change my medicines? And, important, say you're on potassium. Potassium pills are pretty big. And so, um, having a plan for potassium supplementation is going to be really, really important, because the size of pills are going to be, really, really important in terms of how well you'll be able to take the pills after surgery. And so just being able to ask those specific questions before surgery and then immediately after surgery. So as soon as you have surgery and you're able to leave the hospital, be discharged, having some contact with your primary care physician so that, or nurse practitioner, so that they can follow you along, um, in the immediate after surgery period. Um, Understanding that, you will certainly have the close follow up from the bariatric surgery clinic, but you will get, you'll have that coordination because there may be some things that, um, sometimes the medications, um, may need to be resumed until you hit a point of more significant weight loss, and then they can be decreased. Sometimes, you may need some different medications, for the issue, and so that close follow up between your primary care physician or nurse practitioner and the bariatric clinic is going to be really, really important. And then, as you embark on your post weight loss surgery life, um, knowing that it's there's hard work at every part. The first phase is the what's challenging and difficult won't be what's challenging and difficult as time goes by. It's really important to stay connected, with your primary care physician and nurse practitioner, and very, very important to continue following up with the bariatric surgery clinic. And as I'm thinking, I'm talking years out. So the follow-up routine in the first year is pretty frequent in the weight loss clinic. But then as time goes by, the follow-up spaces out. And many people find themselves in a 1 year follow-up, 1 year follow-up arrangement with the bariatric clinic. It's really important to make that follow-up appointment as well as to continue the follow-ups with your primary care physicians and nurse practitioners, um, because um, because the problems that preceded weight loss surgery that improved, for some people, those problems can come back, and identifying those early is a lot better than waiting, a lot later. There are some other considerations, kind of as people are years out from weight loss surgery. There are some risks. So people who are years out from weight loss surgery who, no longer think about it, no longer tell people about weight loss surgery. If they have new primary care physicians or nurse practitioners, they may not be aware of the need to screen for certain vitamin deficiencies years and years and years out. And so, having, your primary care physician or nurse practitioner aware, of your previous weight loss surgery can be really, really important and can help identify some of those vitamin deficiencies. And two in particular, vitamin B12 and vitamin D. And I've had many instances of people who were 10 plus years out from weight loss surgery, with symptoms that were due to those deficiencies that it wasn't, it wasn't obvious, that from the, at least from the chart, that they've had the weight loss surgery. And so it's one of those things that it allows the primary care physician or nurse practitioner to assess for those potential deficiencies that can be common if you're not supplementing with the multivitamins and the supplements that are recommended after surgery. And so being able to let your primary care and other things in terms of the years out, there are some uncommon things that can happen um, after surgery that has a little different consideration. So, considering problems of, severe acid reflux or things like that in someone who's remotely out from surgery, what you do or how you evaluate and manage things can be a little different. If there was an awareness that there was previous weight loss surgery. Um, so, it's one of those things that is really important, particularly as as healthcare providers change, physicians, nurse practitioners retire, move away, change positions, as you reestablish with new physicians or nurse practitioners to, have them aware of your previous weight loss surgery status. And I guess one thing that I'll also talk about, and it's just more from my experience of patients who've had weight loss surgery. Um, there are some problems that um, weight loss surgery can improve, um, that can get to a point where you've maximized what weight loss surgery can do, and it's just important to recognize it. Um, and I'm talking in particular the joint disease, and I'm talking about arthritis due to what we call wear and tear. That many times people, when they were much heavier, um, they have arthritis that essentially wears the joint out, so that may be a point after weight loss surgery and significant weight loss that that person may have a return of pain that's not related necessarily to weight gain, more related to just advanced arthritis. And so, it is something to be aware of, particularly healthcare providers, for us to recognize that and to properly evaluate you for that, because many times, your joints, there's only so much that it can take, and there may be a period that the joints feel really, really good after the weight loss, and then there's a point where boom, now the joint has, the advanced arthritis has caught up with that person, and they have joint disease that needs more aggressive. And so if you've had surgery, um, you know, and you have significant joint disease, really seek out your nurse practitioner or physician to get that evaluated, because I've had quite a few patients who have done excellent with weight loss surgery. Their joints, their hips, and their knees just got to a point of arthritis, and we needed to, have them have aggressive therapy, and they did really, really well. And so many people previously, haven't had joint disease before weight loss surgery, remember that oftentimes they would hear, if you lose weight, it will help your joints. If you lose weight, if you help your joints. And to a certain extent, that is true. But there's a point where the weight loss no longer helps a severe joint with advanced arthritis. And so, if you're experiencing that pain that's really severe, keeping you up at night, you can't find a comfortable position, let us know in primary care so that we can appropriately get you to the aggressive treatment if you really need it. Um, and so I'm going through trying to make sure that I talked about. Um, so I'll talk specifically about a few diseases that um, pre-surgery. and post surgery look very, very different. One very common disease is diabetes. And so many people with significant diabetes who are on aggressive treatments like insulin injections, other injections, medicines, many of those people are able to be managed with no medicines or very few medicines. And so immediately after weight loss surgery, many people have a significant improvement in their blood sugars. Now, there are some people, and we're learning which risk factors are associated with not having the significant improvement as fast with weight loss surgery. Um, Duration of the diabetes is one factor. So if you've had diabetes for decades, the likelihood of you kind of rapidly and completely coming off of medicine is lower than someone who's newly diagnosed. They have a very people who are newly diagnosed, younger, been on therapy for a shorter period of time. Um, that people who are not on um, extensive therapy or intensive therapy, those are the people who can routinely expect a significant improvement in their diabetes to the point that, you know, when you go to the hospital and you tell people what you're taking, you won't be taking those medicines when you leave the hospital. And so that's a significant change. What I will say about diabetes is that diabetes is a chronic disease, so that even if you're not on medications, it's still important to monitor yourself for diabetes regularly. So if you've had weight loss surgery and you're no longer on diabetes medicine, it's still important that you're getting the routine diabetes care, that your blood sugar is being assessed periodically, that you're checking your feet, that cholesterol is being checked and addressed if you meet criteria for cholesterol medications, and that you're still following up, getting your eye exams, that your kidneys are being checked routinely, that even though you are not managed on medications, you're still getting the surveillance type things because um, it can happen that people who have had diabetes for a long period of time can have a period where their blood sugars are managed without medications, but may reach a point in the future where we have to restart some of the medications. Maybe not all of the medications that you previously were on, but some medications to address the blood sugar. And that goes back to the chronic nature of diabetes. High blood pressure is similar to diabetes, where you can expect significant medication changes after surgery. Um, the Most often, blood pressure medications are not continued, but it's still important to make sure that your blood pressure is monitored. Um, for some people, they will still need some blood pressure medications even after surgery. And so that'll be really important to make sure that those numbers are being monitored. And even if you are not on the medications, it's important to continue to monitor your blood pressure. It's one of those things that is monitored at every visit. That's just part of standard care now, is to measure a blood pressure. So that's one of those things that can be watched as long as you're making the follow-ups. And so if you're coming to the follow-ups, you're getting that assessment of your blood pressure. Um, Sleep apnea, it's one that's worth discussing with the sleep apnea provider. And it's one that I struggle with the best answer. When when are people able to stop wearing CPAP? At what point in the weight loss? And that's a really hard question for me that even to this day, I haven't been able to 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 find a satisfactory answer for me. And so usually I would say, that's a great question for the physicians, nurse practitioners in neurology and pulmonology and the bariatric clinic to kind of talk about, hey, at what point do you get to stop wearing CPAP? But that is a consideration, and that's a question that that's definitely worth asking, particularly those who have sleep apnea. At what point, and then another question, and I truly don't know the answer. Do you have a repeat sleep study before you stop the CPAP? And like I say, I'm still trying to figure out a routine answer, a satisfactory answer, but it's definitely worth bringing up. Um, Diabetes, hypertension, sleep apnea. Cholesterol is something that can be different in terms of when do you stop cholesterol medications? And that's something that it's also something that's on my list. And I apologize for not having a ready answer for you um, because of the way we now prescribe cholesterol medications for many people, particularly those people with diabetes. Um, those people those people from research seem to benefit from being on cholesterol medicine no matter what the cholesterol level is. And that's reflected by the increased risk of stroke and heart attack just by having diabetes. And so cholesterol medicine can be challenging um, to really figure out, hey, is my risk for heart disease and stroke, is it significant enough to continue the medications while I am getting the weight loss? One big challenge is that some of the conditions, and it may reflect our understanding of the chronic nature of some of these conditions, that people with a history of diabetes, whether they're on medicines or not, are at a higher risk than people without. So those people may be ones that the safer or the least risky route would be continuing of cholesterol medications. Um, People who've had some heart disease risk, continuing cholesterol medications may be, and that's something that having the discussion with your primary care nurse practitioner, primary care physician to really get a good snapshot of what your risk is. There's no doubt that weight loss will modify your risk for a stroke and heart attack. No doubt at all. There's no doubt that weight loss will reduce your risk of just dying from essentially any reason, all cause mortality. Um, the challenge exists in our evolving understanding of the understanding high cholesterol, and in particular, which people need the cholesterol medications. We, when I started out, had a very cholesterol level understanding, which means if your cholesterol was this, you got medicine. If it was not, you didn't. And it's involved now to a individual risk assessment, and there are different ways to assess risk. And many of the risk assessments that are commonly used don't involve weight. It doesn't have weight as a factor. And so it can be challenging to it can be challenging to come up with a kind of an automatic response to, hey, should I continue cholesterol medicines after weight loss surgery? Because of the just kind of our different understanding and the good news that the cholesterol medicines, particularly the statins, have a lot of benefits that are there beyond what they can do to the cholesterol numbers. So that's a little harder last year was probably, if you asked me last year, I would probably say, yeah, come off the cholesterol medicines. And now, just, based on, just reflecting on the overwhelming research showing a benefit in the statins, in particular. So that's a that's the conversation that's definitely one that's needed in coordination between your primary care physician or nurse practitioner and the weight loss the bariatric clinic and even the subspecialties. So if it's part an endocrinology, cardiology, that's kind of worth a discussion about the cholesterol medications. I'm trying to think of some of the other things. I talked about arthritis. Yeah, I talked about arthritis. And then I think I've covered some of the most common chronic conditions and medications. Yeah, I think I've covered those. I've talked about prediabetes and the benefit with weight loss and physical activity. Um, yeah. And so what I'll do is I'll stop the formal talk and actually answer any questions that you have. I think if I think the chat box is the best way for questions. So, and I can see the chat box. So if you enter them, I can see it. Um, yeah, if you enter it, I can see it. Vivian, if you have questions for me, you can go ahead.
Okay. Everyone, if you have a question for Dr. Rayford, you can put it in the chat box and he'll answer your question.
So, Vivian, can I ask you a question?
Yes.
So, right now, what is the kind of how are y'all handling cholesterol medicines? Just
Generally,
curious.
we hold them.
Okay.
When they start the pre-surgery diet, we tell them to stop unless it's a particular reason, like they're on an injectable to try to control their cholesterol, they're on oral, two orals, then we just continue it even in the hospital.
Okay. Yeah. Gotcha. And as far as did I miss any big medicines that y'all commonly um some of the changes now? There's some medicines that you need to stay on, like thyroid medicines.
Hmm.
Yeah, so if you're taking thyroid medicines, that's something that, that has to continue.
Yes, and most of the time, the only medications that the patient really just absolutely do not take when they go home is the metformin, because
Yeah.
simply crushed, it's awfully bitter, and they have no control over their blood sugar once they take it.
Yeah.
So generally, we just start them on a sliding scale.
Gotcha. Gotcha. Oh, I got some.
If it's needed, but some most of the time it's not needed.
Yeah. So I actually have some question about what about restless legs? Will surgery help? Huh. That's a good question. I just thinking about um I'm thinking going through my mind. Uh I don't think that the surgery will have a huge impact on restless leg in terms of making it better, but some of the other things that people commonly do after they have surgery, that the increase in like the activity that usually happens around surgery. Many people have a significant increase in their physical activity around after surgery. That may be beneficial for restless legs. Um, and in my mind, I'm just thinking about the full impact. There may be a, if you have restless leg and you notice that that your symptoms are, more significant after surgery. Some people, and it's not common, but a small number of people develop iron deficiency um, after they just develop iron deficiency. It's not super common, but we do know that iron deficiency can be associated with worse restless leg symptoms, and that may be a reason to have potentially your iron checked even before the kind of routine visit. So if you've had restless leg and oh boy, it's gotten worse, it may be something that you continue. I mean, you get your iron level checked, particularly after weight loss surgery. Um, I know you would continue your medications. Um, it's just, sometimes the dosage form itself may have to, and many times the changes after surgery involve dosage forms, particularly capsules or things that can't be crushed. And so it needs like a special consideration about alternatives and things like that. Um, but I don't think it's dramatically helped with the restless leg. Now there are other things in your legs in terms of like people who have pain in their legs and may have joint disease and things like that. That there is some expected benefit from that. Another question is, do you see an improvement with cardiovascular function? Yes. You can expect an improvement in cardiovascular function with the weight loss and the activity levels that many people are definitely more active, and that definitely can lead to an improvement in cardiovascular function. There are people, and now as we have our experience with weight loss surgery is definitely significant. People with cardiovascular disease, the cardiologist, acknowledge that many of those people have a significant improvement in their heart disease with weight loss surgery. And in particular, people with stable heart failure, that's where the heart doesn't squeeze as well. And we have numbers to assess kind of how well it squeezes. So if your number is less than 50%, then you are classified as having heart failure. Um, there have been people that have had a low low number, and that number improve with weight loss surgery. Those people are ones that maybe need to be monitored a little closer around in the hospital. Their fluid, their kind of fluid issues may be a little more need a little bit more attention in the hospital. They may have a little extended stay. We're not talking weeks. We're just saying, those people may need a half a day or a day where you're assessing the fluid function because you don't want too much fluid to um, to to build up in the you don't want too much fluid to build up. But those people may have, and I've seen it. I've had some, examples of people I know personally who have pre-surgery their EF, ejection fraction. So that's that number. That number pre-surgery was around 30, 35. Post-surgery, that number went up to 60. And so, yes, you can expect, an improvement in cardiovascular function. It may not be instantaneous, but there's definitely an expectation of improved cardiovascular function, which is why, many people who have heart disease, and I'm talking about even in the extreme, there are patients who have very severe heart disease, so much so that they would qualify for transplant and things like that. And those and their physicians, the advanced heart failure cardiologists, recommend weight loss surgery so that that person's heart function can improve and that person's ability to receive a transplant can improve. And so we have seen, weight loss surgery being, recommended even for, some kind of more significant, you know, conditions. And so, yes, there's an expectation of improved heart function. Another question was, what are the effects on hormone levels? And testosterone was in the parentheses. Significant weight loss can be associated with an improvement in hormones, particularly testosterone. So for a man, fat tissue, excess fat tissue can have a strong metabolic effect. So the fat tissue can process hormones and can process testosterone and male type hormones into estrogens and things like that. And so many men will notice an improvement in testosterone levels, and that may manifest as improved sexual function, improved muscle, kind of muscle strength, muscle mass. Some men may notice an improvement in mood. Many men may notice an improvement in fertility. So it's really important, men and women, particularly to be aware that their fertility may significantly improve and they're at high risk of becoming pregnant, which because of the kind of the rapidness of the weight loss, becoming pregnant is not recommended, um, definitely in the first year and maybe even 18 months after weight loss surgery, because there could be a risk with the rapid weight loss with pregnancy. Um, there, with pregnancies, gaining some weight, it can be associated with the pregnancies, and then the nutritional deficiencies that can happen with weight loss surgery may be much worse with pregnancy. Now, it's not the end of the world for folks if you end up pregnant in the period after weight loss surgery, but it's definitely actively um, encouraged for people to practice pregnancy prevention things um, around weight loss because you can expect an improvement in fertility. So, are you more, so I guess this question is, are you more likely to have muscle cramps after surgery? Um, Not just in terms of what I've seen from my patients or what I've kind of learned from obesity medicine is not necessarily. I would, um, I would really kind of, if you are having muscle cramps after surgery, a few things. Hydration. Hydration is definitely something that requires some diligent effort in terms, and so cramps are definitely associated with low levels of hydration. And then some people may be more prone to magnesium and calcium, and potassium deficiencies, not necessarily from weight loss, just kind of other susceptibility to it. And so if you're having severe muscle cramps, kind of one of the first checks to do is to just make sure that you're hitting your hydration goal. Make sure you're hitting your hydration goal. And then the next thing to do is if things aren't better, is to kind of make an appointment to be evaluated. Call the weight loss clinic and call a weight loss clinic, or your primary care physician or nurse practitioner. So a really important question about that happens after surgery. What about the extra skin? Um, what about the extra skin that comes from the rapid weight loss? That is something that's that is a factor that many people deal with. That skin changes, skin will uh, stretch over time, but won't recoil in a short period of time. And so many people may have to deal with excess skin, particularly after dramatic weight loss. Um, some people may have severe issues where there's sore skin breakdown, drainage. Those people um, those people will have a easy route potentially of having, you know, having the problem. It's the challenge has been insurance coverage, even if covering the weight loss surgery um, often excludes the surgery for excess skin. And so people can find themselves in a scenario um, where they're not able to have the insurance coverage for the loose skin. I will say that uh, things that you can work on is building as much muscle as you can, but understanding that if you are building muscle, then the number on the scale may not be as reflective. You may have to use the inches. So the inches in terms of your waist, your arms, your thighs, your hips. You may use kind of inches lost as a measure of progress and not necessarily number on the scale. Um, but it is something. I know some of the seminars um, have the plastic surgeons in the area to talk about kind of talk about the post-surgery options for the excess skin. But it is something that people do contend with, and yeah, something that people do contend with, and it's definitely worth considering having a plan for it along with the weight loss surgery that, as you um, think about kind of life years down the road after surgery. But, there's still a lot of benefit. Extra skin is a factor, but there is a lot of benefits, health benefits to the weight loss, even if extra skin is a consequence. So, question was, will these levels be checked after surgery by the bariatric clinic, or will I need to go ahead and speak with my primary care about a plan? So, typically, the with the follow-up visits, there are labs that are kind of early on in the process. The bariatric clinic does a lot of the surveillance and the checking, and so there's usually frequent contact by way of appointments and follow-ups. Um, and so those levels usually we in primary care are involved, a little bit more active. Say there's a problem that, um, blood pressure is still not where it needs to be. You're off of four medicines. Um, if the numbers are high in the clinic, then many times it's, hey, you make a specific follow up with your primary care physician or nurse practitioner to address that issue. And so, yes, so as far as monitoring for the vitamin deficiencies and looking at just kind of a general snapshot, um, those things are done routinely at the bariatric clinic. Vivian, you can tell me, I think 3 months, or is it 6 months? The first time labs are drawn after surgery.
But the labs
Uh-huh.
after bariatric surgery, well,
Yeah.
generally we do those um, at the year mark. It's just because
Yeah.
most of the times with insurance companies, some will cover every year.
Hmm.
Um, so, but if they do have problems and come in complaining of having some symptoms, then we will get a full bariatric lab panel.
Gotcha. Yeah, and so and that's and unfortunately, many of our procedures are informed by insurances, even though we're reassured that we as the physicians and nurse practitioners are really making the decisions. So, with that being said, definitely if you're having trouble, make sure you bring it up. Even though the labs aren't checked, there's close follow up. Is it Vivian? Is it a couple of weeks, 6 weeks, 3 months, 6 months, a year?
Initially, after surgery, they come back for a 2 week hospital return. They see the surgeon and the dietitian. They come back in a month. That's considered as the 6 week, and they the same thing. See the surgeon and the dietitian, and they will come back one more month. That's their third month, and
Uh huh.
after that, they start coming every 3 months up to their year. And after the year, they come every 6 months. And then when they hit the 2 year, they can come every year, but it's up to them. I have a lot of patients that stay on the 6 month course simply because they feel like they'll get off track if they stay gone away for a year.
Hmm. So yes. So so that frequent contact. So definitely if something's going wrong or there's a concern, usually that's enough to get things checked. And then in primary care, we're here to kind of cover the gaps. So cover the times when you're not seeing. And definitely for my folks, many of my time people, if they're definitely in the window and there's a question or concern that comes up, I'll just reach out to Vivian and just, hey, what should I do? Um, Someone's really excited. Good job. Um, it is a life-changing decision, and there's a lot of benefits that can come from weight loss surgery. So, a good job. Um, will it affect asthma? So, weight loss is beneficial for asthma. And so, with the weight loss, you can expect an improvement in asthma. So that's actually good. I'm trying to think of my patients who've had weight loss surgery, and nobody's coming to mind, but asthma is made worse by excess weight. And so people with asthma are expected to benefit from weight loss surgery. A great question about weight loss surgery and fatty liver disease and weight loss surgery in the gallbladder. That's actually a great question. Um, so the first question is, will it help fatty liver disease? The answer is yes. It will, and the degree of weight loss that can commonly come from surgery is enough for improving fatty liver disease. Some conditions, a smaller amount of weight loss can be associated with an improvement. So, blood pressure, diabetes, a smaller amount of weight loss. There's some conditions like non-alcoholic fatty liver disease and sleep apnea. You need a greater degree of weight loss to get the significant benefits. And so, weight loss surgery is definitely something that can help improve fatty liver disease. How does it affect the gallbladder? Vivian, you're going to have to jump in on this one because rapid weight loss can be a risk factor for gallbladder disease. So that, um, it's something that, so excess weight is a risk factor for gallbladder disease, but rapid weight changes can be a risk factor for gallbladder disease. So it's not something that um, automatically gets better. Is something to be aware of. And for some people who are at high risk, I think they're given medications. Is that right, Vivian, to help reduce the risk of gallbladder, particularly gallstone disease, with the rapid weight loss?
Well, we give if you have still have your gallbladder, you'll get Actigall, and you'll take that for 30 days, twice a day, unless you have an issue with gout. If you
Hmm.
have an issue with gout and you still have your gallbladder, you will not get the Actigall.
Yeah. But it is definitely something that comes up that there are some things that requires a little extra attention, and particularly the gallbladder is one. Now, long term, yes, weight loss is great for gallbladder disease, decreasing your risk of having it. Um, I forgot about gout. Yeah, gout is definitely something that would benefit from weight loss. And then another thing that I did not mention that is something that doesn't necessarily go away, that you may need, and it's depending on the specific type. So here, um, the predominant weight loss surgery is the gastric sleeve. Is that 100% Vivian? 100% the surgeries are the sleeves?
Yes, that's correct.
Okay. So there are other techniques, done other places, but with the sleeve, acid reflux. And so it's one of those things that long-term weight loss surgery benefits acid reflux. In the short term, attention will need to be paid in terms of kind of reducing. And if you can just imagine having a stomach that looks like almost like a water pouch, and having that size reduced to now what looks like a banana in terms of the potential for acid reflux with weight loss surgery. So you will potentially find yourself on acid reducing medications to kind of minimize the risk of symptoms from acid reflux. And so it's one that get, may not kind of get may not get better as fast as some of the other things, and it may be something that'll kind of need you to kind of manage even in the future. But that's something that's a little, it's more unique to the sleeve in terms of just the kind of technical risk. Um, there are other types of weight loss surgery. So the one that you know done in other places like the gastric bypass, which requires a lot more time and a lot more reconnections and stuff like that. Those surgeries aren't as associated with the acid reflux, but that's kind of something that's not done in this area. And then this last question, and Vivian, this is all you. How long in general is the hospital stay with surgery?
The hospital stay is going to be 2 nights, and then
Yeah,
you're discharged after 2 nights.
gotcha. Yeah. Um, so those were all the questions. If there are more questions, I think you reach out to, the weight loss clinic. Um, hopefully, I was able to answer some of the questions. And yeah,
Yeah.
hopefully I was able to answer some of the questions. But it's an incredible tool that we have for obesity and improving many aspects. And talking to your primary care physician, a nurse practitioner, and then asking those questions. Do you expect my problem to get better? And then, you know, continuing that relationship. And the most important thing that, I want for you, particularly those who are definitely decided, planning on it, right on it, you know, make sure that you commit early on that no matter what happens, you're going to follow up. You're going to keep coming, 3, 4, 5 years down the road. Keep following up. Keep following up.
Okay. So I'm assuming there are no more questions. Really appreciate you doing this, Dr. Rayford. And as far as the attendees, we will have our next one on August 5th. That'll be the next support group. All right. Well, everyone have a blessed night. Good night, Dr. Rayford.
Good night. Y'all have a great night.